Now, more than 1 million people die from tuberculosis annually across the world. The airborne disease is associated with poverty and malnutrition, but drug-resistant TB is posing a threat. In efforts to end the epidemic, Bridget Ngana reports from New York that there are heightened calls to increase funding for the TB vaccine.
This is the fourth leading cause of death in Kenya, and it is a huge disease burden in other countries in Africa and the global south in general. But at the UN high-level meeting on the fight against tuberculosis here in New York, ministries of health across the world are being urged to advance science, finance and innovation and their benefits to urgently end tuberculosis as an epidemic.
Tuberculosis remains the biggest infectious disease killer in the world, claiming over 1.6 million lives annually. Drug-resistant TB is a major cause of global antibiotic resistance and continues to be a global health security threat.
We have knowledge and tools they could only have dreamed of. We have political commitment, and we have an opportunity that no generation in the history of humanity has had. The opportunity to write the final chapter in the story of TB.
In Kenya, more than 120,000 people develop tuberculosis every year. However, not all of them get the necessary treatment. The Kenya Medical Research Institute is currently developing vaccines for both young children and adults in its quest to end tuberculosis in the country.
But there is one important tool we still need, and that's a new vaccine. The only licensed TB vaccine was developed more than a century ago. It saves thousands of lives every year by protecting young children, but does not adequately protect adolescents and adults, who account for most TB transmission.
I urge member states to prioritize tuberculosis in their national agendas and allocate the necessary resources to ensure prevention, diagnosis and treatment, and ultimately the vaccine.
The deliberations here at UNGA are targeted at ensuring that the world is at par between the North and the South in advancing technologies that will help them achieve universal health coverage and, most importantly, global health care for everyone. Bridget Ngana, NTV, New York.
Well, thank you very much, Bridget, for that story from New York.